CBS News political director John Dickerson. John, good morning. So what does this mean for health care reform, and what does it say about the politics of health care?
Well, I think as a practical matter, more than 90% of the companies that would have been affected provide insurance to their employees anyway. So, and also as a part of the president's plan, the Medicaid provision and the individual health parts of the plan, those go forward. So as a practical matter, that's the situation. As a political matter, this is not good. It sort of contributes to the feeling that the Affordable Care Act is a jalopy they're trying to roll out of the driveway here, at barely operational for the president. So that's not good. The White House made the decision, though, take the pain now before the July 4th weekend, rather than have all of these stories over the next year of companies that were laying off workers or having such a hard time implementing this.
John, in announcing this, and I read through the comments at the Treasury Department and the White House, they acknowledge that they have heard the concerns by businesses. It was vociferous and directed at the White House. How much of this is concern that it could hurt Democrats in the midterm elections, that they've delayed this till after the people go to the polls?
Yeah, well, as you point out, you couldn't help but hear the concerns on this issue. The problem for Democrats running is that they are already weighed down by the feelings people have about this bill and about the opposition from small business and from businesses of all kinds. And though this delay again takes the story from being a chronic ailment as it gets implemented, it doesn't really reduce the fact that in a lot of these states where Democrats are running, red states, this law is unpopular.
Okay, so now the employer mandate has been delayed a year. You would have to pay $2,000 for each employee if you don't give them health insurance. What about the individual mandate? That's still in effect, right? You will be penalized if you don't have insurance.
It is still in effect, and the Obama administration is still trying very hard to get people who want to buy insurance in the private market to sign up for that. That's a whole other set of problems associated with this. Will Congress try and take another run at the individual mandate? You might see that in the House, Republican-controlled House. Anything in the Senate, the Democrats wouldn't let that come up. The question for Republicans here is whether public disapproval of this law is a little bit complicated. A lot of people don't like it, but some of those people who don't like it because it doesn't go far enough. So do they see this as a moment to try one more time to go at this Affordable Care Act? The risk for them is that people will say, you know, you've tried this before. We want you to focus on other concerns.
Thank you, John. Happy 4th.
Thanks, Charlie. You too.